center, which is sort of the catch-all for all the different crisis services that you might house in one building. Within that building, we operate a rapid access unit. And the rapid access unit is really that place where first responders, whether they are law enforcement or EMS personnel or anybody else, can bring someone as an alternative to that T intersection that usually first responders have. And that T intersection really is, I can take them to the emergency department or I can take them to jail. Those are about the only two places you could take somebody unless you have a rapid access unit as part of a behavioral crisis center. And so what we've seen in Springfield, and the analogy that I've started using to really help bring this home, is instead of a T intersection, we offer more of a roundabout opportunity where you come into our setting, you get your help or your next lane of care, so to speak. So in that behavioral crisis center setting, you might find that we quickly get you connected to your psychiatry or to your counselor or to some substance use reinforcement and services. And by doing that, you've really created a lot of efficiencies. The first efficiency is that the person that needs help gets it quickly and walks out the door within 24 hours knowing what their needed help is and what their appointment is for that. Law enforcement benefits greatly because instead of going to an emergency department where they're going to slot in behind the people who are having heart attacks and other emergent physical emergencies, they're going to have somebody that they can go to that is specialized to their needs and gives them a disposition in less than an hour on what needs to happen with that individual so that law enforcement can get back to doing what they need to. It's also going to be a huge help to the emergency departments because emergency departments do amazing work, but they will be the first to tell you that they're primarily equipped to deal with medical physical emergencies. And so to have someone that basically can work with them in somebody that can work with them in a very direct manner for the behavioral health or substance use crisis, the emergency departments will also tell you that they're going to greatly benefit. Now, one thing you kind of mentioned that I think is pretty important is that when you talk about mobile responders and when you talk about sort of those other models, this fits hand in glove with those because it's really a hub and a starting point where everything else can interrelate. And so one reason it's worked so well in Springfield, and we think it can work equally well in Columbia, is it creates a context for all other crisis services to operate with and through. The Behavioral Crisis Center has worked so well because it allows us to connect all the necessary services in one location, and it also allows individuals to come in and find what they need or get connected to what they need by an expert. And so we have at our Behavioral Crisis Center psychiatric care. We have social setting detox if individuals need a safe place to come down off of whatever they're on. We have residential beds to be able to help somebody if they need to stay longer for substance use services. But we also have a full continuum of care between what we offer and what others in the community offer to be able to provide people with connections to their counselor, to their psychiatrist, to a caseworker who can go into the home and help them, to a school-based experience so that if they need family support. We have all those things in one place, and we can connect with that Behavioral Crisis Center to whatever you need in the community. So what it is a bit of a one-stop shop, if not for what you need, to connect you to what you need. There's going to be a lot of diversion, and there's going to be two types of diversion. And the best type is the type that you can't measure because it never resulted in a critical incident. And so one of the things we know is that oftentimes when someone goes into a legal context, that isn't just happening in a moment. There's something that's building up to that where a person has been in crisis for a longer period of time. And so what the Behavioral Crisis Center does is really says prevention is the key metric here. And that is, if we can get you in and engaged in care, there's a dramatically reduced likelihood that you're going to end up in some sort of law enforcement context because you're getting the help you need to help manage your life out of the gate. But let's take those individuals that have ended up with us because there's some substance use need or crisis. If we can get to them and engage with them because law enforcement realize that this person needs a behavioral support, this person needs some substance use support, if we can get to them first, then we will have measurably diverted them from landing in jail. And we also know that if we can connect them to services afterward, we're going to prevent that revolving door phenomenon where they keep coming back into context of a law enforcement agency. And what we've seen both in Springfield, as well as what the statistics bear out nationwide, is that this absolutely works and does reduce the reliance on the justice system as the primary means of helping people.